what if rhinoplasty revision is required? Hopefully it's not, but it's a fact of life that a patient undergoing their first rhinoplasty has to accept the chance that there could be another procedure required. Probably a quarter of the noses that we do are revisions of another surgeon's work, and typically those are some of our most challenging cases. If we're revising a really poorly performed rhinoplasty, costs a little more, the recovery is a little longer, takes more operating room time, takes more skill, and you have to accept that because maybe some of the native structures that were present before the failed rhinoplasty, that there may not be as much tissue and structure to work with. Sometimes we have to borrow some cartilage from the ear because there's no septal cartilage to use for grafting. Fortunately, the incidence of my revision where I perform a primary rhinoplasty and another procedure is required is probably about 5%, about 1 out of 20, which is well below the national average. When one of my rhinoplasties requires some revision, it's disappointing for me and the patient, but it usually works out well, because what it typically involves is we've never had to start from scratch, so this didn't turn out good. Instead, what typically requires a revision is that when we sand the bone down and make the bone incision, sometimes there can be a little bump of bone that will be sticking out a little bit, and it's necessary to sand that down. We have to wait a whole year before we can do it, but we have to sand that down. Sometimes a part of the nose will settle. Most commonly, we can handle that with a little bit of filler, which tends, with a couple treatments, tends to last a really long time. Another thing which occasionally requires revision is that if the tip is real droopy and we bring it up, it wants to go back. And so there's a chance that we might have the tip settle more than the patient and I would like, and we have to bring it up. There's cost and recovery and risk and everything involved in that. What I typically do is I'll charge a short operating room fee to cover the cost of our anesthesia personnel, but we typically don't charge a surgeon's fee for that. If filler is required, if a little bit of filler is required, then I'm happy to provide that with patients and include that in the cost of the rhinoplasty.